Hello, hello, and welcome to Shots Up, a Midwestern conversation about health, wellness, and how to stay safe while protecting our community. All right. My name is Bijou Star. I am the midday host on 93.1 WZAK, and I'm in Cleveland, Ohio. Did I say that already? Cleveland. Hey, now I am joined with my friends from all over the Midwest, Radio One cities, who are joining in this conversation today. So, let y'all introduce yourselves.
Yeah, you represent Radio 1 Cleveland. I got to represent Radio 1 Columbus in the capital city. I am Nails, the midday host here at Power 1075, 1063 in the capital cities.
And once we are talking about Ohio, I am Tropicana. I do middays here in Cincinnati.
Okay, I will represent Indiana. I'm Tina Cosby with WTLC AM 1310 The Light, also heard on 95.1 FM and 97.5. Anyway, I'm right here in Indianapolis. We got a whole bunch of simulcasts, so thank you all for having me. Yeah, I can't get to all of them. I'll get it, but AM 1310 The Light, we're on the light.
You all over, Tina.
We're all over, and I got to get it right. So,
and as Bijou mentioned just a few moments ago, CareSource linked up with all of us here at Urban One and Urban One Columbus, Urban One Cleveland, Urban One Cincinnati, and Indianapolis to have a candid conversation about what shots you need and how to get healthy and stay healthy. All right. And today we're going to discuss the CareSource mission of why vaccines are important and how they can keep our community safe.
All right. Thanks, Nails. Now join me in welcoming our first guest of two for today, Donna Gabbard.
Good afternoon.
How are you?
I'm good. How are you?
Doing wonderful. Thank you for joining us. Can you tell us your role at CareSource, your clinical background, and which market you work in?
Most definitely. I am Donna Gabbard. I'm Director of Women and Children's Health for CareSource within the Ohio market. I am a registered nurse by trade. I've been in the business of managed care for more years than I care to share. Actually, it's 20 plus years. My clinical background has been with adults as well as children, working with children with special needs. And so this is a great opportunity for me as I think about working with women and children.
Indeed. Donna, thank you so very much. Let's bring in our second panelist, and she is Keisha Zachary. Keisha, welcome.
Thank you for having me. My name is Keisha Zachary. As you already stated, I am the Director of Strategic Partnerships for CareSource Indiana. I've been with CareSource for about 7.5 years. And prior to coming to CareSource, I worked in the local community. I have a community-based background, more on the social service side of things. So it was definitely a jump for me switching over to an insurance company. However, I oversee our life services department, which is our department that works with our members on social needs. So all things outside of the doctor's offices. And I also manage the community marketing department. So those are our employees that are out in the community that go to events, things of that nature. So thank you for having me today.
Thank you. Bijou.
Thank you so much, Keisha. All right, so before we get this thing started, let's hear a word from our CareSource Ohio.
Here's the thing about Medicaid. You don't have to be stuck with the plan you have.
Right now, you can switch to CareSource.
My CareSource Medicaid is ranked #1 in Ohio for quality.
I get so much more than health benefits, like my own life coach.
And help finding a job.
Does your health insurance do that?
More people in Ohio choose CareSource than all other plans combined.
Now you know why.
We choose CareSource.
CareSource.
Your Medicaid?
Your choice.
First and foremost, I have to talk about CareSource, right? It is our passion. It is why we're here. CareSource is a managed care organization that has been in business for well over 30 years. We serve 2 million plus members across 6 states: Ohio, Indiana, West Virginia, Kentucky, Georgia, and our last acquisition was Arkansas. So we have really grown over a 30-year time span. Our mission is to make a lasting difference in the lives of our members, to ensure that they have the best possible care and health, wellness, and outcomes. So we live our mission daily, with that focus being to understand our members. We focus on population health. And you may say, well, what does that mean? Well, with population health, our goal is to understand our members, what drives them, what is basically impacting their health and wellness. We know that health and wellness is so much more than physical health. So we focus on social determinants of health and removing those barriers, again, to ensure our members' health, safety, and welfare.
Thank you so much. All right.
So can I ask a question really quick? And my question's for Keisha. I just want to know why do you feel, why is it important for public health? Why are vaccines important for public health, and especially the minority population?
Absolutely. So vaccines are important because it keeps us safe. Most people may not understand the reason behind vaccines, and especially in our particular community, there's so much history surrounding minorities and trust and all of those things. We know those all too well. But essentially, vaccines are there to provide us with immunity. So the best way to describe it is that a vaccine gives you a small dose of whatever that particular disease is, to where you build up immunity. So with the flu vaccine, we know that each year there's the request for us to get a flu vaccine. So they basically inject a small portion of that particular vaccine, of that particular strain, so that your body can build its own immunity to fight off that particular strain should you come down with the flu during flu season.
Okay. Thank you.
Yep.
Donna, how can vaccines reduce risk?
Vaccines reduce risk for all of the population involved. So we focus on receiving vaccines within our specific age groups, those vaccines that are recommended. However, while we are receiving those vaccines, for example, adults receive the flu vaccine as well as children, we are protecting others that do not have the ability to obtain those vaccines. So again, vaccines are protecting not only those receiving the vaccine, but those that are not. So that is the goal. It also will reduce the risk and complications related to other health-related issues and concerns. So that's why vaccines are so very important. And it's across the spectrum, from infants, children, to through adulthood.
And then I'd like to add on to that, when you said protecting others, recently with the COVID vaccine, one of the main reasons that I took my vaccine is because I wanted to be able to see my grandmother. She has so many different conditions, and she wasn't able to be vaccinated. And it's very, very hard to go to someone's house and you're talking through them through the window because you can't see them. So I was extremely grateful to be able to vaccinate myself and my family, because there's nothing like granny's hugs. And so that was just a main point for me. And we also have a member advisory council here in Indiana where, you know, our members, we talk with them to find out what their experiences are, what their needs are, any hesitancy that they may have surrounding the vaccine. And the two things were being able to see family and to be able to travel. So I can relate to both of those things. So it's not only protecting yourself, but also protecting those around you as well.
And so, Keisha, can you explain exactly how vaccines offer the protection and the immunity? Because there was so much confusion surrounding this early on into the pandemic, and sadly, some of it remains. But I think this is a great opportunity to give a great explanation for those who are watching.
Absolutely. So again, I mentioned it a little bit earlier. You're basically giving your body a chance to build up how to fight off something. So we've heard so many cases, true story. So I had COVID prior to it being a thing. And I just remember what that felt like. So when I received my shot, I didn't experience any really symptoms because my body had already built up immunity because I had already experienced it. And also through my household, it kind of spread, but I was the person that probably experienced most symptoms because I had it first, not knowing what it was. Husband still around me, kids still around me. So as it went through my family, everyone's symptoms kind of decreased more and more because they had built up immunity just from being around me. Does that help with the explanation?
Yeah, it does help. It does help with the explanation. I want to just follow up a little bit more on that. And you mentioned it, you alluded to it when you talked about vaccine hesitancy.
Yes.
Early on, and that was rampant in our community and in the communities of color to the point of paralysis in terms of just, I'm not going to do it. I'm going to get it. So has the messaging surrounding the effectiveness and how the vaccines offer protection and immunity, has that improved or clarified any so that we can get away from whatever is left of the hesitancy? And I will say, vaccine paralysis.
Yes, absolutely. So as I mentioned earlier, we have member advisory councils. So when you come from a medical lens or clinical background, you speak all these big words. And so you're like, I don't know what that means. So I'm just not going to do it. And so the hesitancy that we experience, again, historically, I don't know enough about it. I'm not going to be the first person to try it. Let me see what somebody else experiences when they take it. It's like, I'm going to wait and see what happens. So we ask our members firsthand, what is it that you need to make you feel more comfortable? So it's all about providing education, asking what is the best way that you would like to receive information.
That's good.
Who do you look up to? Like, who do you need to hear from? And in the minority community, there's a grandma, a aunt, somebody has like the voice of the family, and if she says to do it, I'm gonna do it. So I just think it just depends on you have to ask those that you are working with, what is it that they need? And generally it boils down to communication and communication that one can understand. We can't use those big terms. We have to bring it down to, this is what this is. If you have questions, you get to ask questions. And if I don't know the answer to something, I need to say, I'm not sure, but I will find out. So it's all about communicating, being aware, saying what it is that you do know. And if you don't know something, to share that with people too, so that they can make an informed decision.
Thank you.
All right.
I would like to add to that, if I may, real quick. We also realize that we have to develop relationships within our communities. We have to implore and bring in community leaders who are trusted, such as faith-based organizations, such as individuals within those communities who our membership or individuals look to as trusting individuals to provide that communication and those messages. So again, we cannot do this alone. We have to bring in those trusted community partners.
And Donna, just asking you another question, what impact does having the vaccines have on our everyday lives?
So having the vaccines impacts our everyday lives, and we're seeing the results of this today as we think about moving out of the pandemic. We're seeing herd immunity. And what that means is that the majority of Americans are now immune to COVID-19, right? Now, when I say immune to COVID-19, I want to preface and also say that when we talk about vaccines, back to Keisha's earlier statement, a vaccine is providing and ingesting or infusing a strain of a disease into an individual, right? That's why we have seen resurgence of certain strains, such as the Omicron, creating increased COVID-19 numbers. While we provide immunity, what we know today is that we cannot provide complete immunity to all strains moving forward. So that's a message that we need to make sure that we're getting out to our membership and to our populations, that yes, we basically are messaging, get your COVID-19 vaccine, you'll be immune to COVID-19. And then we see these resurgence of new strains. And that is why it's so important that, yes, while we may still get COVID-19, it's not going to have the same severity and impact That's why it's important to get those vaccines.
And it's ironic you mentioned that because, in April, we just heard about Vice President Kamala Harris, who's vaccinated and boosted,
Yes.
still tested positive for COVID. And this question is for Keisha. How do we get the word out and let people know that vaccines keep the community safe when we still see that?
Yes, it goes back to like what Donna stated, that we have to find out who are the voices of our communities. Get community stakeholder buy-in. You have to. And just share information, look at your trusted sources, partner with the health department because we do not have all of the information. You want to partner with the health department. Here in Indiana, we have a strong relationship with IIC, which is the Indiana Immunization Coalition. So those would be the experts. And two of the things that are also an issue as it relates to vaccinations is access and transportation. So it may be that I work different hours and I can't get to the doctor to get my vaccination. Or here in Indy, we have these huge vaccination clinics at the Indianapolis Speedway. And so you have to drive up and all of these things. Well, if I don't have a car, I may not be able to do that. So one of the benefits that we offer to our members that are interested in being vaccinated, and not just for COVID vaccination, any vaccines, we are having vaccination clinics, is that we provide free transportation to the event should they want to attend. And then we also just want to make sure that we are going to the community. So we partner with community-based organizations, faith-based organizations to set up clinics in the neighborhood where the transportation, the time, you don't have to worry about all those things because we want to meet our members literally where they are out in the community.
Thank you.
Wow.
You're welcome.
That in itself is amazing. Now, Donna, how does CareSource support members who receive their vaccines when needed?
So we are supporting our membership through numerous platforms here in Ohio, and I know the same, I'll refer to Keisha here in just a moment. Here in Ohio, since 2021, we have again been staging multiple COVID vaccine events. During those events, we have been offering through the Ohio Department of Medicaid gift cards for vaccinations, including the first dose, as well as now we're offering for booster doses as well. So this supports our membership in regards to any additional needs that they may have to either obtain the COVID vaccines or afterwards. In addition, we ensure that our members are getting back to additional COVID vaccine events or Department of Health to get that second dose as needed. And we also offer support to our membership in regards to any follow-up questions or concerns that they may have or any health issues that they may have as a result of the COVID vaccines. So we've worked with our providers, our community-based organizations, and our members so that they are aware of opportunities to receive the COVID vaccines, of our gift cards or rewards programs, follow-up second shots or boosters. So we ensure that our membership is aware of any additional needs as a result of receiving those COVID vaccines.
And we have a similar model here in Indiana as well. We have member incentives, we have reward programs. We also have provider incentives as well. So we work with all of the pieces of the puzzle. We're working with our members, the community, providers, community-based organizations that we incentivize not only the COVID vaccination, but also we have member rewards programs for all vaccines to ensure that our babies, our kids, our moms are all up to date on their vaccinations. Especially it's huge when it's time for a kiddo to go to kindergarten. If they haven't been up on those vaccinations, then they may just be like, oh my God, Mom, I don't want to go to school because I have to get all these shots. So we try to make sure that there's an immunization schedule. So we try to make sure that all of our members are up to that schedule so it just doesn't feel so overwhelming for families and for kids. I know you guys all know someone that does not like shots, but so we try to introduce it to them early. So when you keep up with that schedule, it's like, okay, 1 or 2 here and not 17 or 18. I'm exaggerating, but not that many when it's time to go to school.
All right. Well, Keisha and Donna, thank you very much. We're going to take a quick break right here to hear from our friends at CareSource Indiana. We'll be right back.
Imagine a health insurance company that could look beyond doctors' offices and hospitals and help its members find what they need to actually live healthier lives, like a stable job, dependable transportation, or a safe place to live. Well, that health insurance company is not only real, but making a real difference in Indiana right now. At CareSource, we're removing barriers, we're improving lives, we're reimagining health insurance.
Okay, Keisha, we're gonna keep it right here with you.
Okay.
The CareSource is known for going beyond traditional healthcare. So how do social determinants of health factor into minority health? Social determinants, I'll let you explain that, but how does that factor in?
Yes. Okay. So this is the feel good part of my job. This is really what attracted me to CareSource. Yes, this is the feel good part.
Okay.
So all along, I'm thinking, medical insurance. Oh my gosh, it's insurance. It's a claim. It's going to the doctor, right?
Right.
But with CareSource having a nonprofit status, our CareSource was started originally by a social worker. So social workers, social needs, they have a clear understanding that what happens inside of the doctor's office, that's not just the whole person. So there's so many things that have an impact on one's health. So it is where you live. It is, do you have access to food? Do you have access to transportation? Do you feel safe? Do you have all the basic needs, essentially, that you need to be able to survive? So we found out that if I am concerned about what I'm going to eat, my next meal, my clothes on my back, if my kids have adequate childcare, I am not going to make my health a priority. I'm going to make sure that all the other things are aligned first before I worry about medication, going to the doctor, because life is always happening. So the social services and social determinants of health is basically all of the other things that have a significant impact on our health and health outcomes. When I am employed, educated, all of those things, I'm not necessarily in crisis. So now I can focus more on my health. I can focus more on making sure that I'm taking my prescriptions and not using the emergency room as primary care because there's been a crisis. So essentially, social determinants of health, we have a whole department, which is the life services department, that focuses on supporting our members that have those barriers. We use a life coaching model in that we help our members identify their own barriers, because it's not for me to say this is a barrier for you. We definitely believe that our members are an expert in their own lives. And so whatever they deem to be a priority or something that they want to work on, we help them. We definitely have a do with, not do for model. It is a program that is voluntary. Our members can opt in to work with the coach, again, for up to 2 years to find out what is it that they want to do. They may not know. So we have different assessments that they can take. We connect them to resources that already exist in the community. So it is just, like I said, it's the feel good thing. Just to know that we use a holistic approach. Yes, we are concerned about cost of care and all of those things, but we know in order to have an impact on that, we need to look at the entire member. And we also know that certain areas, certain demographics, certain individuals experience disparities. So we're looking to close that gap too. We are not blind to the fact that there's inequities that happen everywhere. So we just love that we're able to address those things and take that into consideration when we are developing new programs, incentives, and all of those things. Donna, do you have anything? I could talk about this all day. So.
You did an awesome job with that, Keisha.
Okay, thank you.
Well, you know what? And it's funny that you asked Donna if she wanted to add, because I was going to say the same thing. Donna, you touched on the mission, Keisha, but if Donna, if that's all, but if you had anything you wanted to add about the company's mission and what CareSource does, because Keisha did give a great description.
No, Keisha covered. She did a great, awesome job with that. So again, we focus on our membership and what their needs are. That's our focus. Yes, we are managed care. Our goal is to retain costs and provide the best outcomes. But at the same time, we know that we cannot do this for our members. Our members need to be empowered to do this for themselves.
Well, I want to take a second to thank you guys both for taking some time out and having a conversation with all four of us representing the Midwest, Donna Gabbard and Keisha Zachary representing CareSource. Thank you guys so much. The information that you gave us is that we can use this with our friends and our family that were hesitant on getting the vaccines, and we can actually enlighten them on how it helps our community in the long run.
Absolutely. Thank you for having us.
And before you guys get out of here, you have to tell us where we can learn more about CareSource and facts about vaccines.
Most definitely. So if you'd like to learn more about CareSource and the opportunities that we provide regarding vaccines, please visit our website at caresource.com. You can also connect with your local health departments and or your providers or doctors, because they have all of this information. Again, our goal is to increase our vaccine numbers across every state and make sure that our members are getting the vaccines that they need.
Absolutely. You hit that on the head. This was so much valuable information. Thank you, ladies, for your dedication to our communities and the services that you guys provide for us. We appreciate you so much. And make sure that you guys like this video and share it. You might save a life. It might be yours.
Thank you.
Absolutely. Thank you for having us, and thank you for all you do as well.
Exactly. We appreciate this.
Bye-bye.
Bye-bye.